Good morning, good afternoon, good evening, wherever you happen to be. This is Firoz Manji from Daraja Press, and welcome to the show on organizing in the time of COVID-19. Today, I have a very interesting discussion with Mavis Kugatsitse, whose name I'm hoping I'm pronouncing right, who is the Executive Secretary of the Southern African Trade Union Coordination Council, SATUCC, which represents 22 major federations in 14 of the 16 SADC countries, the Southern African Development Community member states, with a combined membership of something in the region of 5.8 million working men and women. They've recently published a statement which extends solidarity and sympathy to the workers of the entire population around the globe who are facing a huge health risk because of COVID-19 outbreak, and which now records a large number of cases and deaths. I'm very pleased to introduce Mavis to the show. Thank you for joining us, Mavis. Welcome to the show.
Thank you very much, Feroz. Thank you for inviting us, and we are very happy to do this interview with you today.
So it seems that millions of workers across the SADC region are being affected, but they're not just being affected by being infected, but by policies which result in a lockdown. And as I understand it, many losing their jobs. Could you tell us a little bit about what workers are facing in the SADC region?
Yes, thank you. There is a lot that is going on right now that affects workers. We've been getting reports from national centers about different government interventions and responses to COVID. And whereas some governments have tried to say that they will try to cushion that no one loses their job, there'll be no retrenchments, and that there should be wage subsidy. But we know that the reality is that some of those responses are not practical. The reality on the ground is that employers also, rightfully so, would claim that they are also being affected and they're making losses. Therefore, they are not able to sustain their businesses the way they've been doing. And therefore, some have resorted to forcing people to go on unpaid leave. Others are saying that they can't continue. People must just be at home until the lockdown is over, things stabilize, and then they'll find out ways in which they can either bring them back into employment. And we also know that largely a number of our people are in sectors where it's dependent on work being done every day. So when there's no work, there's also what employers call no work, no pay. So really the hardships, that we've been having in the past, they are now being compounded by the fact that we are now facing this crisis, a pandemic, and they've sort of doubled. And it means we have to think on our feet as trade unions in terms of what we can do, in terms of a coordinated strategy and our efforts to ensure that in our governments coming up with these policies and stimulating the economy and coming up with ways to mitigate, against COVID-19, workers' interests are taken on board, and that there's social protection for all. This also shows us that really our traditional way of doing things and organizing in the workplace, we have to go way beyond that and think about other people that are not in those workspaces, that we really also need to have their rights protected. For example, those in the informal economy, migrant workers, we have domestic workers and farm workers. So those are not in our traditional workplaces where we usually organize. So it is best now we think of new models of organizing, and our focus must be in those groups of people.
Are you saying that SATUCC now has a policy of unionizing informal workers?
Yes. And what we are going to do moving forward is we had already started to move in that direction. What then is fast forward in the process is that we are now caught up in this pandemic. Therefore, we need to really make sure that we move fast in that area. And one of the things that we are focusing on right now, which we've already started based on a program that we've been involved in migration, is that we need to actually set up as soon as possible points where, and sort of a help desk where these people would be able to reach out to us and we can offer them the assistance that they need.
My understanding is that the policies of most governments across Africa, and I assume also within the SADC region, has been to essentially offer washing hands with soap, using alcohol, but key to this is what they call social distancing. Now, I'm not sure, it's been a long time since I was in Botswana, but most of the countries I've visited in the SADC region, many don't have homes, and many live in very crowded conditions, not only inside the home, but in areas where there's intense closeness. Yeah, houses are built right next to each other, if you can call them houses. And so is social distancing under those circumstances really realistic?
Obviously not. It is not realistic. We've actually been talking about it. We've seen, you know, some of the uprisings that were happening in South Africa in the past week. We've seen also some of the people that were actually having their makeshift homes, temporary homes being demolished in Zimbabwe. So social distancing, it does not really work in this instance because traditionally and culturally in our homes, we are large families with relatives, and because also of forced migration, people find themselves in other areas, either you know, local migration or across borders, where they find themselves having to actually squatter in one camp or in one place in very deplorable conditions. So while social distancing is something that is very important to reduce the risks of infection or transmitting, it's something that really we need to think long and hard about in Southern Africa because of the way people find themselves in the living conditions that we are in.
Where I'm from in Kenya, what we see, and it's similar in Uganda, it's similar in Ethiopia, in Ghana, in a number of other countries. We've seen it in South Africa as well. And that is the militarization, the securitization of the streets, where people are being locked down and attacked by armed police and other armed forces, to the extent that even the implementation of curfew, so that at night people have to stay at home. It's bizarre because I don't know whether it's built on the belief that the virus does not transmit during the night, but I wonder if you could sort of comment on what you're seeing in the SADC region.
Yes, we've also seen instances where the military or law enforcement officers are very strict to a point where they even become a bit what I would call brutal. But you know, as I've just indicated, they cannot apply, the rule cannot apply to everyone. There must be exceptions. We've seen, where, for example, in Botswana, you have to apply for a permit either to go to the doctor or to go to the supermarket, and stuff like that. But it has proven that really it doesn't really work, or it should have actually been well thought out in a way that it doesn't bring, even more challenges than we are already faced with. Yes, those who are able to go to the supermarket, there is that, provision for sanitizers, stay maybe a meter apart from each other and stuff like that. But the challenge is that for you to move from your household to the supermarket or to the doctor, you need to get a permit. And the permit system is such a way that at first it was paper, like you have to apply paper. You actually have to go to the offices, and we found a lot of people crowding in those district commissioners' offices to try and apply for permit. Now what they have done is an app in which we can apply for a permit online, and it's supposed to be instant. And there's still also challenges with that, because not everyone has technology to be able to do that. To those who are able to apply, we get a lot of rejections, because also they sort of try to screen before approving the permit, whether your application is legitimate and whether you have, legitimate reasons to be going out. But like we were saying, a lot of our people depend on, for example, those people who are on the streets, who are depend on selling vegetables, selling, airtime and stuff like that. Now they are confined to their homes. They can't even move or go anywhere. So there should have been a provision to say that they can actually be able to access their services, from their homes, whichever way. But I think we've all been caught unawares, and it shows, how much unprepared and not ready we all have been about this. While it calls for learning as we go, because every day, but it seriously provokes us to think of so many other ways that we need to, moving forward, other than just advocating for universal health care, that there are those socio-economic needs that we really need to take care of and seriously think care of. Like the basic wage grant, etc.
So to what extent do you think our governments, our elites, are using the threat of the pandemic to strengthen their hand in repressive techniques that remind some of us who are old enough to remember of the colonial days?
Rightfully so. I think you are absolutely right. We find that in some countries they are actually putting in place state of emergencies, and during a state of emergency, we all know that certain things cannot be done. For example, the right to strike, or riot, or any form of leverage that people might try to use if they are aggrieved. You also find that even in democratic societies, very strong democratic societies like Botswana, where a health crisis like this, we don't feel it should be dealt with by having a state of emergency, but rather there are other tools and acts of parliament provided for that can actually be used. So it's actually this is a health crisis which should be dealt with purely in that regard by health professionals and experts, and of course economists, because then that is affecting the economy as well. But you find that it's being politicized now. I mean, it's politicians want to be the ones that are leading you know, this war on COVID-19, which I feel in its own way, we all know how politicians operate. It's not always in good faith. It's always about self-serving interest. Yes, there may be some isolated good examples, but really, genuinely and honestly, politicians always have something to benefit from a crisis, no matter how, you know, deadly the situation is.
The impression I get is that, with very few exceptions, most workers across the SADC region are in any case very poorly paid. They live almost from hand to mouth. The wage which comes in is spent the next period. It's gone. There is no possibility of savings or whatever. There's pressure on over the last 30 years of privatization of healthcare, privatization of everything that is around. And now workers, as I understand it, are faced with being laid off or confined to home, even if they've got a formal job. How are they surviving? I mean, is this, how do they eat? What's going on? Can you give us some idea of the lives that working people face?
Yeah, the plight of workers, they've really gotten worse. I mean, it's quite disheartening. As I have said before, some people have been technically been laid off, even though governments will still say that no one should lose their employment. And some have had pay cuts, like where, you know, they get half of their salaries, and you can imagine even their full salaries is not enough, is not adequate, you know. So if it's cut in half, what that really means, because they cannot have any form of sort of extra income. So, and then we have really those who come from breadwinners, from very underprivileged families, really. So now what we've seen is that some governments have been trying to do subsidies, government subsidies, and then also to have food baskets distributed to households. That alone comes with its own challenges, because you find that, you know, even the way we document our documenting systems in terms of who is where their needs, and the information that is supposed to be gathered by social workers, it's only now that they are beginning to do that, to assess the situation in every household. So you can imagine, if we've been on lockdown for more than a month, for 4 weeks now, and some families, even though social workers haven't reached yet, and they're still in the process of, you know, assessing to see whether one qualifies to get that. So, and you find that they'll also start in the cities where you find that at least there are better and privileged people who also, they may not be going to work, but they're still getting their income and full package. Now, by the time they extend and go to those people that really need the assistance, it will already be too late. I mean, you get people in the remote areas who just yesterday, people, you know, information was coming in from, you know, different countries in SADC to say, including Botswana, to say that they haven't even received anything. They haven't even seen those social workers for food basket. So really, the thing is, the most serious thing that we should be thinking about is, whereas they are putting in those measures, our people, our communities are going to die of hunger before they even get infected with COVID. So I think, you know, we really need to rethink, you know, how to come up with packages which are more sustainable in the future, because I don't believe this is but this is not the first, and I don't believe this is the last pandemic or crisis that we are going to have. If another one may come up, it may not be a health one, but we need to be prepared, going forward, in terms of making sure that we have the necessary database that documents everyone and their status and what their needs are, so that we can readily be accessible to them and to assist them when the need arises.
One of the effects of the lockdown in many countries has been that people are confined in small spaces, lots of people in one household, and there has been in many countries a growth in the violence against women and violence and child abuse. Could you say something about this within the SADC region?
Yes, we've also seen that the challenges of the lockdown has brought in other things, really, like gender-based violence, violence against, children. We've seen a rise in so many of those cases. Just I was talking to a women's group this morning, and somebody was telling us that in Zimbabwe already they have 17 people, women who've been killed by their spouses during this lockdown, and it's happening everywhere. In Botswana, we've just had a center for women that shelters women, telling us that they've seen that there's a lot of cases coming in, and they were pleading, with society that maybe we should also come up with, places where we can actually host these women in the meantime. Gender violence really is a serious concern, and if we don't put in place already measures in which we'd be able to deal with such issues, and I know trade unions, especially like in Zimbabwe, in South Africa, here in Botswana, in Zambia, have really been coming up to say this is the time, where we can all come together and find, lasting solutions, not just temporary solutions. And where as women would be rallying behind each other to say, can we find a safer place to keep these people? But it should also be not only for civil society to be, to be spearheading some of these things. Governments must actually, come up, because where there's a regulation, it is better to deal with some of these issues, especially also that we have international labor standards, we have international conventions that we can actually fall back on to cover the protection of people in this instance. So we need serious laws where, instead of us saying these women should be kept somewhere and run away from their homes and leave their children with the abuser, maybe these abusers can be given temporary accommodation in jail, so that the woman can be left in the household with the children and take better care of them. Because if they leave them and go elsewhere, it's highly likely and possible that the abuser then would take that out and lash out on the children. So really, we need a systematic and very, coherent way in which we can take care of this situation.
But you say you've been talking to women's group this morning about some of these issues. So what's the possibility for women to organize, to make these demands? What's a possibility for workers to collectively show their strength in demanding that their conditions is taken seriously, that their policies and proposals are taken seriously? What are the possibilities for organizing in the time of COVID?
I think what we need to really do as women is that we can lobby and have advocacy, for and the campaign for ratification of, recommendation 190 on ending violence and harassment in the workplace, but not just in the workplace, because it extends even in the household. So I think we need to really rally around that campaign, and create more awareness, because I think if we do that, it will bring women, together and strengthen us in this fight against COVID and post-COVID-19. As I said, you find that a lot of women, those like forced migration, you find it's women going and looking for work as domestic workers. You find that, even in the frontline care workers, they are largely women. Teachers, largely a number of them are women. So I think we have a very good chance to really organize ourselves and amplify our voices during this time.
And in terms of, you raised the issue about food and access to food. I mean, presumably in many, not all, but many of the countries in the SADC region, it is small farmers who are the producers of food. To what extent then has the lockdown prevented them from earning a living in this situation? And what do you think are the possibilities of links, formal links between trade unions and organizations of small farmers?
That one is really a very serious issue at the moment, because we for example here, because of the lockdown, even people can't go to their farms to harvest. So you find that there is a lot of produce that is going to waste. And we've actually been saying the ministries that are responsible for agriculture should actually have exceptions in terms of allowing people to go to their farms, because if the chances are, if the produce is going to waste, if they don't harvest, there's even going to be more challenges, after this. One, it's their source of income, but it's also how we can feed, our households and neighbors in the communities. So as trade unions, one of the areas that we need to do, like I had said, is that this is a chance for us, to organize around, small farmers, informal economies, workers, street vendors that are in the corner of every street, but you don't find them now. But for as long as we don't stand out and send word out there that we are here as trade unions and we are here to work with you, to help you, to be your voice, then we'll continue to have people being, apprehensive, because all people are used to is that, trade unions belong in a formal setup, in a workplace, in a workshop somewhere. But they need to know that they can be comfortable enough to approach us at any given point, and that we are also open and very accessible to them, to assist them, to push forward, for better policies and for better, stimulus packages for them, to be able to continue to earn a living.
Yeah, it's a great challenge. One of a comment that I've heard from one or two people I've been talking to recently point out that the introduction of the virus into Africa has largely been from visitors from abroad, from Europe or from the US. And it is the middle classes who are the bringers of that, because nobody else has a chance to travel internationally. Uh, and so they're the ones who have been the transmitters, and very little has been done to focus on confining them. Uh, but it looks like it is working people and farmers and others. It's the population at large, the impoverished, who are the, these people say are the ones who suffer most, even though it is the middle classes who are the ones who brought that in. What's your reaction to that?
I think rightfully so. I mean, given the evidence that we have in terms of confirmed cases, most of them are imported, with people who travel a lot or who were coming from abroad before lockdowns. There are very few instances where you have local transmissions, and you find the local transmissions also started because somebody traveled from abroad and they went straight to the village where they mingled with people, their families, or they went to a funeral and stuff like that. So I think our government should have been very strict and started off with mandatory quarantine in isolated areas, because I think the mistake that was made was to think that people are responsible enough to self-isolate in their own households and keep away from everyone. But as the right or wrongfully so, but privileged people are some of the most selfish people that we can ever come across, because they are the ones that, instead of self-isolating, they would be wanting to go to the shops because they do have the cash anyway to go and buy. They are the ones who would be driving around attending their social events because they have the means to gather and socialize and party together. And we've seen that really extend to the most marginalized and vulnerable people in our communities. And when we are supposed to be the ones to protect them. So I think for starters, as you say, it was really wrong that we didn't enforce mandatory quarantine, at the beginning of all this. Just about 2 weeks ago in Botswana, our parliamentarians decided to hold parliament. Instead of doing it virtually or otherwise, they decided to meet. And what transpired after that was that the nurse who was actually testing them were tested positive later on, which then meant the whole parliament had to be quarantined, including the Speaker of Parliament of the National Assembly and the President. But the issue is where it's possible not to meet, people shouldn't meet. Even the regulators themselves, the ones who are in authority, they should lead by example. They have the means to technology to do teleconferencing and telework, all that kind of stuff that other people don't have access to. So we should have seen them actually leading us in that direction. We've seen presidents of neighboring countries visiting each other at the time when there's COVID, claiming that they are going to discuss their strategies in terms of how we are going to handle it, because our societies are very much integrated. But I think really this has also proven that we have, like I indicated in the first place, we have self-serving interest. When instead of service above self, serving other people, being selfless, we tend to think of ourselves first, those who are privileged, and ignore the consequences or the results of or negative impact of what that might have on those who are less privileged. So it's a great lesson, I think, for for all of us, and especially also for us as trade unionists, because we share a platform, tripartite platform where we can create a conducive, environment for social dialogue, to say that in any case, as trade unionists, we fall more or less among those who are privileged, in a way, but there is many of us, there's many of those that we represent who do not share the same privilege as some of us do.
So there are other particular health workers who I'd quite like your perspective of in the SADC region. Doctors and nurses and medical personnel, health workers as a whole, their ancillary workers there, as well as domestic workers. Can you give us some sort of sense of what are they facing, and to what extent are they becoming the front line in helping to resolve the situation?
Yes, we've seen doctors have to be up on their toes, to make sure that they reduce the risk of infection or transmission. Therefore, they are the ones also who are doing the testing, the doctors and nurses. They are the ones who are out there, creating awareness, giving out messages. They are also the ones who actually go, out there in terms of, when you take social workers who go into families, so they are more exposed than everyone else. So we've seen that there is lack of, PPE protective clothing for them. We've seen that, even for domestic workers, those who still go to work, whether the families that they work for, make sure that they make them aware, educate them, and give them the necessary, equipment and assistance that they need. So really,
is that happening though?
Hello?
Is that actually happening for domestic workers?
No, it's not happening. We domestic workers really are facing a bigger challenge, like more than anyone else at the moment, because there are some who were locked down within their families that they work for, but then there are others who were locked out outside. And so the issue here is those who were locked out, it means they are not, coming to work. And therefore, you find that the employer would continuously be asking. I personally get asked by people, relatives, friends, whether they should pay their domestic worker even though they are not coming to work. And I'm like, but they are not coming to work because of the situation. And based on the contract that you have, they are still in employment, and therefore you must pay them. And then those who are actually locked within the homes that they are working for, they are, I would say, the risk also of them getting infected by virtue of them being in their workplace is very high. So we were, the whole thing about saying that we know that if you get infected in a workplace, obviously whatever it is must be treated as an occupational disease, and therefore it must also go along with the right compensation for that, and that you must also get the necessary medical attention that you need, that is, and the cost must be borne by the employer. So you find that there's a lot of conversations around that, to simply try to educate people and say, a worker is a worker, whether it's a domestic worker, a migrant worker, a factory worker, manufacturer, and all workers' rights must be protected. So it's still very difficult to make people understand that there must not be any separation or distinction between the two. When we talk about a worker, we mean a worker, and you must protect their rights regardless of their status.
So to what extent in the SADC region are domestic workers, health workers, doctors, nurses, ancillary workers, to what extent are they actually unionized?
We find that unionizing of healthcare workers is something that started about I think 3-4 years ago, because most of them have been in the public sector. It means that it only took, just recently for them to unionize when public service now opened up for them to unionize. And then you find those in the private sector are largely not unionized, which is something that we really need to think about and make sure that we take advantage of the opportunity that COVID-19 brings for us to get closer to them and make sure that we can unionize them. For example, in Botswana, we have a union of domestic workers. I know in South Africa, they also do. So we really need to intensify, our efforts and advocate that domestic workers must at least get a special permit.
I think you've frozen. I hope we can get you back, Mavis. This is such an interesting conversation. Let's see, perhaps your internet connection has gone.
Can you hear me?
I can hear you, yes. Okay, yes. Can you hear us?
Okay.
Yes, please continue. It just seems that the video has gone down, but please continue. I think we've lost the audio as well. Let's give her a couple of minutes to see if she can get back in. I wonder what we might be able to do. Let me try sending a quick message, and please be patient with us. Now, I think maybe she'll try and log in. It's only for a last few comments from her. It'd be a shame not to say goodbye to her after her contribution here. Let's see if she can get back in. I'll give it another short time on that. Meanwhile, if you're watching, just to let you know that this afternoon at 2 o'clock GMT -5, I will be meeting with Lewis Gordon, an extraordinary philosopher of Africana and other studies, and I hope that you'll be able to join us then. And then this week we have a conversation tomorrow with Özlem Gona on the situation in Rojava in amongst the Kurdish people, and also Ashish Kotari from India will be talking to us about the situation there. We have a number of other interviews lined up, but just waiting for confirmation. And we've had just confirmation that next week on Tuesday we will be having Medea Benjamin talk about the situation in the US. I think the reality is that Mavis has lost her internet connection and has not been able to join us again. So I'd like to thank you for joining us on this show. Please feel free to share with your friends and others. And thank you for joining the show. This is Firoz Manji from Daraja Press, and saying goodbye from Organizing in the Time of COVID-19.